What's up, guys? Dr. Boyd here. So happy to see you here today. Just wanted to take a few minutes. I want to speak here live on a very special topic that I keep hearing questions and questions and questions about. So I was like, you know what? I'm going to go ahead and do a live video. Let's go ahead and do a video and put a lot of the questions to rest because I keep getting them so often. So let's just go ahead and talk about it. And that it comes down to pellets versus injections for testosterone. So pellets versus injections. This is something that, let me start by saying that there's not a right way or a wrong way. There's just a best practice and a not. Okay. And I'm not here to bash any other type of doctor or this or anything. What I typically see is that it's more so usually naturopathic doctors that prefer doing pellets. And what I will say is that understand, you have to take a step back. This is where you have to put your consumer hat on. Instead of your patient hat, your consumer hat. And instead, stop and look at things of like, what's entailed with this? Usually with a pellet, for those folks that aren't aware or that haven't been exposed to it in the past. So what happens is, typically with a naturopathic physician, someone comes in, they'll go get blood work. They say, you know what, I feel like I could be better, or something feels off, or what have you. And if the hormone levels show that they're not optimal, particularly in terms of testosterone, but usually these pellets are a combination. It's usually not just testosterone, or for women, just estrogen or what have you. It's usually a combination of different hormones all in one pellet. And it's an actual pellet. I don't have anything that shows the exact size, but you can kind of think of it kind of like a Tic Tac. It's about the size of a Tic Tac is what you would see. And what a naturopathic physician does is they make a small hole with a scalpel. It's usually right in the upper buttock. They pop the pellet in, so it's there in like the small fatty area. They put in one stitch, or they'll use a little bit of Dermabond, some glue, and say, okay, come back and see me in like 4 to 6 months. And that pellet is supposed to slowly break down over time. And as it slowly breaks down, that it just kind of leaches out hormone. And that's how it's supposed to work. It's a pretty good business practice because you basically pay for the surgical office visit, that one little cut, you pay for the pellet, and then usually you pay for labs, and then 9 times out of 10, you usually sold some supplements. Okay. I don't like pellets. And I don't like pellets because I've seen on the other side of it. So for those of you here in Alpha One Protocol Secrets that, that you've seen me and you're like, okay, it seems like a pretty nice guy. So my background as a physician, I'm an MD, I'm a medical doctor. There's a lot of stuff with traditional medicine that I don't agree with. There's a lot of stuff with chiropractic and natural medicine that I don't agree with too. But what I am for is I'm all for whatever's best for my patient, which means any modality, whatever it is, as long as it's going to help move my patient forward, that I'm all for. So what I'm really, really big on is data and making sure that you have facts so that you can make the right decision for you. That's it. Just being straight up. You have to understand something. With a pellet, what can happen is you can have things come about where it's breakdown. And so the whole point of the pellet is that for it to slowly leach out hormone, for it to slowly break down. Your body slowly breaks down this foreign thing that you've now put into yourself. And the problem with it is that your activity level versus mine versus somebody else's is different. The more you're moving around and generating body heat, the different timing that pellet is going to break down and leach out hormone. In theory, it seems like it makes sense because you're like, okay, I'm putting this thing in and it's going to slowly release hormone instead of getting big spikes or crashes of hormone. So in theory, it makes sense. But particularly if you live in a warm climate like Phoenix, if you're an active person, if you're going and you are, 9 times out of 10, if you're a dude and you're on testosterone replacement, you're trying to get your life straight, you're trying to get your body straight, you're trying to be a better version of yourself. So you're working out, you're doing things that's going to generate more body heat. A lot of times I've had guys come back and say, hey, had this pellet here, I don't really feel it anymore. And it happened sooner than I thought. 9 times out of 10, they were using like a weightlifting belt or doing something where they were putting pressure on that area and caused it to break down faster. So there's a lot of variables at play that you have to consider. So then it raises the question, okay, well, what about injections? Testosterone injections, the old-fashioned way of doing it is injecting into muscle. Is that the wrong way? No. It just physiologically, it's not optimal. And here's the reason why. When you inject into muscle, muscle's very vascular. It's the reason why muscle is red. Proof that muscle is red, well, look at any meat. If you've ever eaten a steak before, if you've ever walked through the meat section in a grocery store, that's muscle you're looking at. It's essentially, I know it sounds kind of gross, that's basically what our muscle looks like. It's red because it's so vascular. There's lots of blood vessels in it. So when you inject testosterone into muscle, it absorbs fast. And then after it absorbs, your numbers come down here relatively quickly. So you have to inject more often. Usually also you get spikes and crashes. When you inject into subcutaneous fat, we all have, no matter how fit you are, we all have fat in the love handle area. When you inject into that area, particularly if it's formulated correctly, so you have to have a doctor that's prescribing testosterone that's formulated to go into that subcutaneous area, then what happens is you've now basically created something that's time release in a fatty solution in a fatty area. And so it will slowly dissipate into the bloodstream. And what's nice about that is it keeps a level nice and constant, which is really like how our body makes testosterone in the first place, so that it's nice and constant. And that's really what you want. That's really where you get the best effect. It's the most scientific and logical approach, and it works beautifully. Plus, it hurts way less. When you inject into muscle, it freaking hurts. If you've ever had a flu shot or anything like that, like you feel like after a couple of days, you're like, oh man, it's still sore, right? Or you'll get a knot in that area. Injecting into subcutaneous space, it doesn't hurt anywhere near as bad. So this is what I do with my patients. I don't use pellets, for all the reasons I stated. Don't inject into muscle for all the reasons stated. And that's what we do inject into, is to subcutaneous fat. It works absolutely beautifully. I always get questions. Man, I don't like needles. Well, no shit. Nobody likes needles. No, of course not. Right? But the fact of the matter is, we use the thinnest possible needle that there is, so that when you inject in that area, it's relatively painless. After you do it 2 or 3 times, you're a pro. It's really, really very, very easy. And it works quite nice. The next part of this is that I have to say, so that ends the debate. Let me just stop right there and say that ends the debate. Pellets versus injections. When it comes to injections, muscle versus subcutaneous. There's your answer. You're welcome. Alpha 1 protocol. So here in Alpha 1 Secrets, I give you a bit of what we talk about in Alpha 1 protocol, but just a bit. Alpha 1 protocol is for men right now, for men in Arizona and in soon Orange County, California. And it's for men that are really looking to become the best version of themselves. So here's the thing. When we're not the best version of ourselves in our body, when our health is not on point, when we're overweight, when we're not feeling energetic, those all show up in other areas of our life. I know this from firsthand. I struggled with my weight. I struggled with my physical activity level, all of those things for a really, really long time. And what happens is that it leads to decreased productivity in other areas of your life. You don't show up as well with your wife or significant other. You don't show up as present with your kids. You sure as hell don't show up as well in business. So it affects your productivity and your ability to make money and to utilize time. When you begin to understand that your health is the foundation of everything in your life, that's when it all changes. And you realize investing in yourself is where ultimately you get to the next level. Alpha 1 protocol is a group of men that understand this so that they can be the best version of themselves, for their family, and ultimately for their community. We have weekly calls where we just finished a super powerful call where we actually talked about like our relationship with money and background with money and where that all came from. We actually go pretty deep into who we are, who we want to be. So if you think that this is just a program where it's like, oh, it's just another run-of-the-mill testosterone program, no, my friend, not at all, not even close. And the next level to this is then, of course, stepping into your physicality, because once you start getting all those other areas of your health right, and you step into that physical space, building muscle, building your body, it builds confidence, and that confidence shows up in every area of life. So if you're watching this, I hope you take to heart the whole pellet versus injection from a men's health expert. And the next part to that is shoot me a direct message. If this message resonates with you about Alpha One Protocol, stop sitting on the sidelines. Like, you joined this group for a reason. You joined Alpha One Secrets for a reason, which I'm happy to have you in this group. But we'd love to have you in Alpha One Protocol in the Brotherhood. That's what I got for you guys. Remember, health is wealth. Invest in yourself. I'll be talking to you again soon.